I can go ahead and introduce our guest because I'm going to be very, very interested in this segment.
All right, we have Dr. Gaeta in the studio. You may have heard his commercials on the radio, but we thought we'd bring him in and talk a little bit about what all he actually does and how he can help you have improve your smile, so to speak. So,
yeah, absolutely. I'm a general dentist in Northport, Florida. Here, I've been here for about 20 years.
Yeah.
And, from Omaha, Nebraska, born and raised there, and grew up in the restaurant business. So I really know how to take care of people. And I've been a board certified implant dentist for about 18 years now. And one thing that I enjoy the most is helping seniors. And a lot of times what happens is in my earlier days, these old people would come in and they couldn't chew, and I'm going, well, you know, is there any help? And so I learned dental implants, and for about 20 years now I've been doing dental implants, and I'm a board certified implant dentist. And
well, for folks who don't understand what that all is, I mean, a lot of times people, you know, they have their regular teeth, and then they have the situation where they pulled out the teeth and they put in these false teeth, and now you keep hearing about dental implants all the time. What actually is a dental implant? Where does it come from? Because I remember hearing about transplanted teeth before, but what is an implant? What does it actually involve?
Well, an implant is by definition, it's a man-made replacement for the root of a missing tooth. So it's actually a screw. It's a titanium screw that replaces the root. So once you take the tooth out, you can place an implant right in the same socket in the bone. And then what happens, because it's a screw, it'll integrate. The bone grows and locks the threads in, and then you can put a tooth on top of that. So basically, an implant is a man-made replacement for the root, and it's made out of titanium, just like a hip or a knee. And another interesting fact is that implants have the highest success rate in dentistry today.
Now, what are these things made out of?
Made of titanium, just like
the tooth is actually titanium.
No, the root is.
The root is, okay.
And then you place a little post within the root, within the screw itself, and it's got some internal threads, and you thread it in there.
Right.
Then you can put a crown or a cap right on top.
Okay, and those are made out of
they're made out
porcelain?
of all
Ceramic.
Ceramic. Okay.
Just like you probably had.
Right.
So.
Very good. I mean, remember when I was like 14, I went over the handlebars of my bike. I used my mouth as a landing gear.
Right.
Came in, a 3-point landing. It was perfect. Took everything out of the front, took these 2 teeth out, and so over the years, they've done this, they've done that, and they've done this. But the last time they put in like those steel points, or I guess, or whatever, that's what they call them. That was 15 years ago, I bet, or if not longer. And then they put the caps over the top of it. So it's kind of similar to that, but this probably sounds a little bit more advanced than what I got.
Right. Now, as a youngster, when you knock those teeth out, you still have the root.
Yeah, I did. They were actually there. They turned like brown because they were dead.
Right. Now, what an implant does is it replaces that root that you had inside in the mouth. So, yeah, that's the major benefit of a dental implant.
Now, is this a lifetime thing?
They last under if they're placed in the mouth under good conditions, they can last a lifetime. I learned from an old implant dentist that I bought an office from in Port Charlotte. He did his first implant in 1958.
Wow.
He would show me cases where all the other teeth would be gone and the implants would still be there.
So it's pretty permanent at that stage.
It's a permanent restoration, and the nice part about it is that people don't realize that you lose bone. Once you take a tooth out, you constantly lose bone in that area. So when you take all your teeth out, you constantly lose bone unless you place a dental implant in. Because there's an alveolar type of bone, there's a different type of bone that actually houses the tooth itself. And once you take that tooth out, that bone resorbs, and you constantly resorb. So that's why I have a book coming out called Stop the Silent Aging Process with the Magic of Implant Dentistry, because people don't realize that you lose bone, you constantly lose bone, so you look older. And
so if you had a bridge or something like that, you're actually losing it underneath that bridge area.
Right. Yeah, where you don't have any teeth.
Right.
And you constantly lose it. And my goal is to create enough awareness in the world about that, because people don't realize that. And then another interesting fact is NIH, the National Institute of Health, has done a study where you lose 9.8 years off your life due to inability to chew.
Yeah, well,
Wow.
yeah, I can understand how that could
I
happen.
can't afford that, or it's just around the corner.
Yeah, you're already checked out at that point.
Yeah.
So,
All right, now, I mean, can this happen for all your teeth? I mean, each one of the teeth back there, you can have an implant
you
for.
can, you can give you back the teeth that God gave you.com. You know, you can have all your teeth replaced.
Really?
You can throw away your denture. I have a lot of patients that people are welcome to call me at the office, and I have a lot of really good patients, longtime friends that have thrown their dentures away, and you know, they're able to chew. You can chew anything. You know, it's about quality of life as you get older.
Absolutely. So if I walk into your office and I say, you know what, I've just made the decision, I'm going to get this fixed. And say I have a full set of dentures, and we'll just use that as an example. How long does it take to have all these screws and things put together? I mean, it sounds like an erector set, but I mean, how long does it take to do that?
Well, the treatment can vary. You can place an implant sometimes and put a tooth on it or anchor the denture right away. You can have immediate placement and use those dentures and those implants right away. Or it can take a period of time. What we do is we check the density of the bone, just like when you put a screw into a piece of wood.
Sure.
In the lower anterior down here in the mandible, on the bottom and the front, the bone is like oak. And
Pretty tough.
yeah, it's tough. So you can when you put the dental implant in, you use a torque wrench.
Yeah.
And you
So
torque it
yeah,
in and
I'm understanding this because I have 4 screws in my back, and it's kind of what they use is put those screws in, and then they had a little set screw that puts the rod through. But so you're using the same type of thing to put it into this post into your jaw. Jawbone, and then you can put the tooth on top of that, correct?
or an anchor.
Or an anchor.
for a denture. Let's say you have a denture, you can place
I'm
2,
doing
3, or
yeah.
4 implants down on the bottom
Yeah.
and snap the denture on top of it. So you don't need to replace all your teeth.
Oh, okay.
You can just create an area
Okay.
of retention where you can snap your teeth in.
Okay.
So you can do
So
2,
you're not talking necessarily having,
one tooth per one implant per tooth. No,
Yeah. Okay.
not at all.
All right.
And I use something called a fence post analogy. You know, if you have let's say Hurricane Charlie comes through, and you have a 30-foot fence with only 2 posts. It's not as strong as a 30-foot fence with 4, 8, or 10
Right.
posts.
Okay. I
So
got you.
you know, the implants are the same, and and what I always recommend to my patients is, you know, do as many as you can afford, because
Right.
more implants is better because it's stronger.
Right. Sure.
Okay,
That
so
makes
you
sense.
can do 2. or
See,
3
I
or
had this
4.
image that you were doing an implant for each tooth that
Yeah,
you
me
did.
too.
No, you don't need to do that.
Yeah, I
You
see.
You can do, and then there's various forms of anchors. You know, and on the upper jaw, you can do anywhere from 5 to 8 implants. In the lower jaw, maybe a few less because of the density of the bone on the lower jaw.
You ever have to take them out, unsnap them?
Yeah, you can snap the denture in and out, or you can screw the denture in and out, or you can put caps on it on the implants. Okay, so you can for all the implants, there's various forms of prosthetic appliances that you can either put a denture on it, or you can put all caps. Like good friend of mine, Herman Macklight, he's an implant patient of mine that has all fixed teeth. He threw his denture.
So he did do all the different posts.
Yeah, he
He had a whole bunch of them. He's got all individuals.
Right. Not all. They're not all. They're all hooked together.
I see.
He has about 8 on top, and
Uh-huh.
then he has a full complement of teeth on top,
I see.
and then he has about 5 on the bottom, and then a full complement that are actually cemented in, and you don't take them out.
Right. Yeah, you don't take them out. They're just like my 2 in the front. They're just there all the time.
Right. Exactly.
Unless I chew something I shouldn't
Unless
chew.
you go over the handlebars again.
Yeah, I try not to do that. It was not a good experience the first time around. It's not one of those things you really want to do again. Let's see. By doing that, you can effectively walk in and have a new smile in a day or so. Then.
Yeah, if the conditions are right, a lot of times what I'll do is nowadays with the technology, we actually do a CAT scan of your jaw. We can do a CAT scan where we have a mobile CAT scan unit that will come to your house, take a CAT scan of your jaw, and what I use that for is I use it as an adjunct to treatment. And what I can do is I can see I can determine the density of your bone.
Mhm.
And if your density of the bone is really strong, we can place an implant, literally have teeth the same day.
Really?
Now, this is something I'll have to consider because after 40 years, the cement that's been holding some of these caps in, every year or so, some are coming loose, have to be reattached, and it's a big pain.
Right, sure. So, I mean, that's common. That's very common.
Speaking of pain, how much pain is there
Yeah.
involved in this?
Well, interestingly enough, there's not a lot of pain with this type of procedure
Really?
because the implant is placed in bone, which has virtually no nerve endings in it at all.
Huh.
So I've had patients that I placed 10 implants in, and just a couple ibuprofen. It's amazing the amount of
Wow.
the amount of discomfort that they don't have.
I could have done that with my back. That's wonderful.
And it's nowadays with the technology we have, I can make a surgical guide stent where we virtually don't even have to open the gum up. We can go right through the gum. We have like a little football mouth guard that has some guide posts, like little straws that come out of it, and you can place the implants right through those.
And boom, there
Wow.
it is.
Yeah, so it's and another great thing that I do is that I do IV sedation. I do IV conscious sedation.
All right, what is that?
So
I have no idea.
IV sedation is like if you had a colonoscopy done, or they used to
Okay.
call it twilight
Sure.
sleep. And I put some medicine in your arm,
Mhm.
and I call it moon juice. I send it to the moon. I do all your dentistry. I bring you
Well,
back.
mostly knocked me out.
Yeah, right, pretty much, and that's what it does. But
Yeah.
but by definition, conscious sedation is that the patient responds to verbal stimulation. Okay, so I say run, open, run, close, and you respond to me, but you don't remember what's going on, so you're amnesic.
Yeah.
That's the best part of it.
That sounds scary.
Do you guys know what the best sound is a dentist can ever or a dentist can ever hear?
What?
You know what the best sound is?
Silence?
Snoring.
Snoring. Snoring.
The patient's snoring, because if I know that you're comfortable,
Mhm.
I'm comfortable.
Ah.
Okay, so, and my profession really needs to look at that because it's not about teeth. It's about
You don't ask any other questions while you're under this.
Yeah, that could be the scary part.
That's what I was thinking. Oh, I might be talking in my sleep. It's going to be not a good thing.
Right. So at my office, I'm trained in both placing the implants and restoring the implants. Okay. A lot of times nowadays, there's dentists that will, if you need a root canal, you got to go to another dentist, or if you need some periodontal work or gum work, you got to go. And I do it all. I was trained at Creighton University in Omaha, Nebraska, and they taught you how to be a rural dentist.
So it's kind of like a one-stop shop in some
Right.
respects.
Absolutely.
Okay. Cost, and that's always a big thing on people, particularly seniors' minds. What is any of this covered by any of the Medicare, Medicaid, stuff like that, or is it all out of pocket? How does this work?
The teeth that go on top of the implants are covered by dental insurance.
Okay.
And now with that implant dentistry is becoming more and more popular, more and more dental insurance companies are covering a portion of the implant that's placed in the jaw. So we're seeing more and more insurance companies covering implants, and they can range anywhere from $1,500 up. So it all depends on, like I said, with the fence post analogy, how many you want,
How much you got to do? How it's
and then
expensive.
bite force too. If I have somebody that's larger, if I have a younger male that has real large masseters and he's a big guy, you definitely want to place more implants than the 95-year-old that has a soft diet.
Someone who gets the implants and stuff like that, and has been timid about eating certain foods, et cetera, can they go back to eating stuff like steak, corn on the cob, and chewing stuff up?
Absolutely. You can chew anything. You can chew apples. You can virtually chew almost anything.
How about ice?
You can chew ice.
Oh, good.
Absolutely.
I'm a big ice guy.
Good, because I've cracked so many teeth on ice. That and popcorn seeds. All right, we're going to take this quick break. We're talking with Dr. Gaeta. We'll talk more with him when we come back on the Morning Magazine here at WENG.